Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45-50 minutes or so discussing the topic of marketing five-star Medicare Advantage plans. These are programs that have been rated as top of the market in a manner of speaking, and they vary according to distribution by different carriers and in different areas. Long way of saying they're not everywhere. But they are a viable option for agents in certain markets. It's a question of considering the entire picture then of network and other benefits that come into play with the programs as well. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel. Additionally, your Premier Agent Success Manager, the marketer that you work with, will have access to these as well. But you can find them on our website as soon as they're available to be posted. You'll notice in today's software package as well that there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that we cover many of them through the course of the presentation, but we want to make certain that we have all your inquiries covered to make certain you get full advantage of today's presentation and the time that you're investing in it. We'll start, however, with a little bit of a level set about Premier Marketing. Many of you are very familiar with us, some not so much. So we are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country, licensed in all 50 states, acting as an insurance wholesaler through an independent insurance agent such as you, through contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products that include programs such as what we'll discuss today with the Medicare Advantage plans, but also Medicare Supplement and Part D prescription drug programs are available as base Medicare coverages. We also, however, have a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, hearing, critical illness, cancer plans, hospital indemnity, accident, and telehealth programs. That way we can take care of the needs of the population we serve across the board thoroughly, not only accessing plans to take care of basic needs, but also specific needs for the prospects and clients that we discuss programs with. The Medicare Advantage programs include the national carriers and many of the strong regional carriers that make a difference for you in your market. And you'll find that many of these are the ones that have the opportunity to create and maintain and offer five-star programs. That same philosophy of giving broad distribution of programs carries over into the prescription drug programs, where many of these plans are available as part of the contract that you have with the MA company. A couple of notable exceptions: the Mutual of Omaha program is for PDP only, different from any of their other contracts that are out there, and the Clever RX program is a discount program, not a formal prescription drug plan. In the Medicare Supplement arena, we have a large portfolio of products, including programs that help you market successfully in this space. And you'll see that some of these programs may be affected by five-star availability plans, or the availability of five-star plans available in the Medicare Advantage space in certain markets. It makes for an interesting conversation then when it comes to what may be best for me. When we look at the ancillary products in each of the categories, we have the national leaders there for you. These not only cover a specific need and create additional revenue for you as an agent and an agency, but it also gives you the opportunity to market in a different fashion, not as heavily regulated as we see in the true Medicare space. When we look at that Medicare market, however, we see a burgeoning, growing, near exponential growth of folks being eligible for Medicare, over 63 million supposedly at this particular point in time. And if you look at things based just on age, we hear the silver tsunami, the aging of the baby boomers, 1 every 10 seconds, 10,000 plus a day. However, we see that there's an increasing number of folks working past the age of 65, not accessing their benefits in their entirety through Medicare for one reason or another. Tail end of the baby boomers have to work till 67 to get the full Social Security. That might be a factor. The pandemic has changed people's outlook on many things, some retiring early, some being interrupted in their planning process, so they have to work longer. So there's one reason or another, but it tempers that number of folks based on just age when it comes to the Medicare market. However, we see that there's a good portion of folks on Medicare that are under the age of 65 accessing Medicare benefits because of disability, and these folks are prime candidates for the discussions with five-star programs. We see that people, when they come into Medicare, they have choices. They don't have to do anything. They can actually decline Part B, self-insure for that portion of it, live as cheaply as possible when it comes to premiums, because there is a premium for that Part B, obviously. Thankfully, not many people do that. They may self-insure for the difference, the shortfall between the A and B coverages and actual cost, pick up a standardized Part D program to help with prescription drug costs. But we see the majority of folks will either choose a standardized, modernized Medicare supplement and add drug plans, or go into the bundled benefits of Medicare Advantage Part C programs, where our five-star programs reside, our topic for today. The choices between them, well, what we've seen in the past is it's been a pretty even split between Medicare Advantage and MedSup when people first go into Medicare, if they're aging in or late to Medicare, whatever it happens to be. You see a portion of the population that say original Medicare only. This may, however, include folks that have retirement programs through work or a union that they worked with. It may be people that have VA benefits. It may be people that are dual beneficiaries. And it may be people that have made that decision to stay with just original Medicare, or didn't decide anything at all and stayed there by default. However it is, in each of these categories, when we visit with folks, the five-star programs, if they are available in a particular market, can make a big difference when it comes to choice. And that's been tweaked a little bit over the last couple of years because of the pandemic, where we see an increasing number of folks going into Medicare Advantage plans. Might be because they're comfortable with that type of delivery system because of what they've had at work, or for whatever reason it is. However, we see a need for a discussion of the different types of programs that are out there, and this illustrates that for us to a great deal. We also want to make certain that we're communicating properly with the folks that we have available to us in our discussions, and that includes translating some of the language that's out there. Every portion of our life has a little bit of a acronym type of situation. Friends who are heavily involved in the computer world, that's a different language entirely for me. CMS helps us with the language that we have with Medicare, which is a different language for many people who aren't involved in it as well. It also, however, gives us, beyond the ability to translate those acronyms, a reminder for us as agents to be careful with our use of acronyms, to make certain that we can minimize that, or at least define them as we go along, so the folks really understand what we're speaking of and how that can affect their different choices. And those choices obviously are governed by the government when it comes to when someone can do something and how. And that includes through the standardized election periods, which we're all familiar with. We're already at the end of May at this broadcast, and starting in June and July, we'll start talking about 2023 benefits for some folks. However, that's in the future. So we deal with election periods. And one of the election periods, special election periods, that is a great source of discussion is our topic for today. And that's the five-star special election period, where the individual on Medicare has an opportunity to change their coverage throughout the year, one time a year, and do so and be effective at the first of the month after the request is made, after the enrollment period has been in there. This is interesting to note because Well, you still have the other considerations when it comes to a comparison of plans. What are the networks that are involved? What are some of the ancillary benefits that come into play that are of special interest to people? How are our explanations of this program helping with the confusion that may be out there because of some of the television commercials and other advertising that comes about that basically has confused many people? It gives us, however, an opportunity to really help people that really need it, because outside of the other special election periods that are there, and there are a number of them that give us an opportunity to change people's coverage to other plans that may not be 5-star rated, but may well be a good choice for that individual. Well, across the board, it's necessary because people aren't examining their coverages year over year. One of the latest Kaiser Family Foundation surveys that were out there tells us that at one point in time here, and just a couple years ago, 7 of 10 Medicare beneficiaries did not compare Medicare plans. So they may have some surprises that came about because of changes in the plan benefits themselves or in the medication coverages or whatever it happens to be. So having a special election period that allows us to speak to highly rated programs can make a huge difference for these people that didn't take the time or the effort or whatever it happened to be to examine their coverage year over year. And that includes folks that are in some of the very most precarious positions, the people that are most vulnerable for changes in their program and may not be aware of it. And we want to make certain that we are able to help people across the board, but it's of particular consideration to people that are most vulnerable. This includes some of the changes that are brought about by prescription drug programs. And so we'll see in many circumstances, folks that have self-insured for the medical portion and picked up a Part D program, or perhaps have a Medicare supplement and a Part D program, that need to examine this coverage. And that may bring about an opportunity for additional Medicare Advantage business for ourselves as agents and greater coverage for the people we discuss, because the medication coverages are a huge factor when people come to making choices as to what they do and what they do not do in their coverages. And this can make a big difference for them monetarily moving forward, even through the remainder of the year. I say that, and we're only in month 5 of 12, but it's amazing how people will ride the pony they came in on and don't realize that there may be a faster horse or something more suitable for transportation for them moving forward. We've got a ton of information that's out there by the government as well that help us in that explanation. And we find that the people that have access to that as well, the beneficiaries aren't using it either. So being able to leverage and reference some of this material, and we'll talk about that in detail in just a second as we pull up the CMS site, but this gives us then the opportunity to make certain that folks realize details are out there. We're there to help them, and we can utilize this information, and we can utilize some of the other informational sources that are put out there by the government that may not be being used either. You'll notice in this particular image, this is a video from 2015, 7 years ago now. 63 million people on Medicare, less than a million views in that entire time period. And it's a very good video. But people aren't accessing the information. They're not even utilizing, in many cases, the electronic information the government has made available to them recently as well. And part of that may be because of technophobia, in a manner of speaking. Some may not have the tools to access it, or some may not be aware of the fact that there are avenues that they can take that will give them information that's crucial for their coverages moving forward. Everyone on Medicare is accessing Medicare and You handbooks, either through the postal service or delivered electronically. We use this in many cases when it comes to what Medicare doesn't cover as a reference for the base coverages. But you'll find that the majority of people on Medicare, they aren't cracking the book and reading it. They aren't looking at the changes year over year. So we need to be able to deliver information to them in the manner in which they'll actually assimilate it into their decision-making process? Are they going to look through some of the information in person? How we deliver that by mail, by appointment, or are we going to do it virtually as well? Because you have tools out there now that can do a comparison of programs and make it work for the individual. And if the technology is available for us that we can pivot back and forth as to that type of delivery system, it can make a huge difference. And so we want to make certain that a population that's becoming more and more digitally savvy receives the information in the fashion that they best can assimilate it, but also it helps us in real-time use of our most valuable commodity, which is our time. And seniors and people on Medicare have been trained to receive information in this fashion. Well, you look at the last couple of years, that's what's happening. Doctor's office visits were done virtually in many cases. I have one physician that I saw 7 times digitally before I saw him in person, simply because of you don't go in the office, that sort of thing. But beyond the doctors, that's also handled by not only primary care and specialists that deliver the care still in that fashion in many cases now, but it's also handled as or utilized by hospitals for working into planned procedures, by dentists, even other aspects of our life, such as celebrating our faith, where the services are all done online. So the folks are becoming more adept at using this information this way and are having the detail and the tools to deliver that information on all of their choices, including 5-star programs, can really expedite the process and give people the opportunity to examine information and make certain that they can make it part of their decision-making process. So as we look at marketing 5-star Medicare Advantage plans, we want to make certain that we realize what makes a 5-star plan. Well, the star process, the star rating system, is a measurement of Medicare Advantage and Part D programs as to how they perform. It doesn't necessarily mean that this is the best benefit. It means that these programs perform well in different categories, including quality of care and the customer service that they are receiving. The ratings will vary from 1 to 5-star plans, 5 being the highest, 1 being the lowest. Plans that are rated in different categories below a certain star rating, well, you'll see them come out with a warning, and if they perform low over a period of time, they're going to go away. It also gives us the opportunity to think of just how many programs now are available to folks that are highly rated, 4, 4.5, 5-star programs, and the majority of people on a Medicare Advantage plan are now in a plan of such a rating. These programs, however, Medicare Advantage plans, are rated on how well they perform in 5 different categories. And this is something we really need to take into mind when we talk about 5-star plans. They look at how the plan helps people stay healthy, how they are performing when it comes to screenings, tests, vaccines. Do you have your pneumonia shot? Do you have this shot? Are you doing blood pressure work? Are we looking at blood sugar, the things of that nature? And if the person has a chronic condition, how is that plan managing that condition? What plan does the providers have in responding to and reacting to the condition that a person has on a chronic long-term basis? It also is rated by how well the plan responds and delivers that care, because it's the old Mike Tyson quote: everybody has a plan until they get punched in the mouth, so to speak. Having a plan is all well and good. It's one of the conditions, but if it's not implemented and it's not being utilized, it doesn't do us much good. Plans are also evaluated on member complaints, problems getting services, and how they can leave different programs. This is a area that we see a lot of movement in, and a lot of it will pertain to the medication coverages in certain circumstances, where the formulary will come into play, and how that can affect a person's satisfaction with the plan that they have. It's also very important for the programs to have good customer service, and it's one of the key components in ratings that makes a five-star plan a five-star plan. When someone calls in, do they reach somebody? Do they have to dance through a number of different electronic prompts? How responsive is the customer service rep that comes into play? How responsive is the actions that are needed to resolve the issue that the person's calling about? This can be affected by agents as well, because many of our clients will call us as opposed to the carrier. And how we react can actually affect a customer's satisfaction with the plan, obviously. Disenrollment, then, if it comes about, well, that's going to affect the rating. And that can be a big difference into how a plan maintains its rating year over year, because they are rated. They come out every October, these ratings. And we see then that people will examine that coverage a bit differently if the rating goes down. Many of them may remain very comfortable with the program they selected because, well, some of these other conditions that brought about a change in that rating may not have been something they dealt with. And so they're still comfortable with the program. But we want to make certain that we as agents support the client's needs, as we always search to do, but that can affect the plan rating overall. It's also important to note that this special election period is a one-time baby through specific times. So utilizing the five-star rating change can be done once per calendar year, and it is outside of the open enrollment period. These enrollments, if they're done after, let's say, after Pearl Harbor Day and the open enrollment changes, someone who makes a change based with a five-star program after they may have made a selection during open enrollment different than that, it's still effective January 1st. And we need to make certain that we realize too that if a person changes these coverages utilizing the five-star program, it's effective the first of the month following the enrollment request. So it's one of the things that happens very quickly, is what we want to emphasize there. And to enroll in these Medicare Advantage plans, particularly if someone has had a Med Sup and they have a PDP program and then they want to enter into an MA plan, the coverages are basic for these programs as to how they can qualify. They got to have the A and B, they got to live in the plan service area, and depending upon the plan selection, that's why I left this in there, they can't have end-stage renal disease with certain programs. Those are D-SNP programs. So the end-stage renal health condition is no longer a factor as to whether or not someone can qualify for a regular MA plan, be it high rated as a five-star program or not. So that's something to consider as well, because no underwriting, no layout periods. It is a program that can get them the coverages the first of the next month very quickly and roll through it very easily. So we want to make certain that we realize too that there are a ton of people that are enrolled in lower rated programs, but they may have great satisfaction with them. And that may be because, well, maybe there's not a five-star program available in their market, or the plan that they selected has the network that appeases their need for the care that they require. So that's something to consider, where you'll see an increase of folks that are going into five-star programs, but that may not be entirely because of the fact that it's five-star rated. Could well be. And it may be because of the fact that you do have a marketing opportunity, or as a beneficiary, an opportunity to change throughout the year, but you're seeing a push up of programs or people that are involved in higher rated plans. So there's a lot of talk about it. Sometimes the folks that we visit with don't know the difference. It's a question of looking at the entire consideration of the benefits that are being offered by the plans that are available to the individual and make certain that that 5-star program is their best fit. What we see in many areas, depending upon where a person lives and if the plans are available, many of the 5-star programs are programs with a narrower network. And for folks that have providers that are part of that network, that's fine. They love it. For folks that don't, well, it's not a valid consideration for them, even if it is a 5-star plan versus a 4 or 4.5. So something we want to look at, but there is a push into higher rated programs. We also see that there are some basic considerations when we look at the 5-star plans and how they compare against other programs. This is an older illustration, but we see that a plan's benefits don't necessarily predicate its rating. You can have a program that may have larger financial out-of-pocket exposure that might be higher rated than a program that covers more comprehensive benefits and makes a difference then for the individual to say, hey, that's a 5-star program. I have an opportunity to change, but whatever. So I want to go into a couple of different things here from a past presentation to kind of illustrate some of the things that come into play here for you. And pardon me for this. Older illustration. We'll roll through some of the different things that are here. I want you to realize that some of the 5-star ratings, this is a 2020 version. And we see as we go through these programs, an illustration of what I was mentioning before, where many of the 5-star plans are Kaiser programs. We now offer Kaiser, by the way, as a vehicle for you in certain markets. But you'll see that when you look at some of these programs, they are plans that may have a narrower network. For folks that are unfamiliar with Kelsey Care, it's a program in the Houston market that has an incredible delivery system, but it is limited to, in many cases, the Kelsey clinics for primary care and then the different hospitals with whom they contract. But you look at a name that pops up a lot, and it is that Kaiser Permanente program that are highly rated. Kaiser has a little bit of a different delivery system when it comes to the care and the availability of accessing that care, because many of their doctors are actually employed doctors. So some of those factors that we looked at when it comes to what makes a highly rated program, well, if the doctor is your employee, that can be a requirement as part of their employment, that they track these different things. They have systems in place for them for the different vaccinations and other things that are standard operating procedure for them. When you contract with a doctor outside of an employment situation, you have less control and lesser influence when it comes to that delivery of those particular parameters that make up the rating. So that's one of the things I wanted to illustrate based on these older illustrations here and the different pieces that come with it. You see in many markets, carriers that will really bang the drum when it comes to their 5-star pieces. And you'll see that with United Healthcare, with some of their 5-star programs. They're all over the state of Texas, so we talk about them a lot here. I'm in Texas, and it can make a big difference. It gives us then also information that we can use across the board. Even though this speaks to United Healthcare's programs, it tells us that, pardon me, there are things we can do to influence these ratings regardless of the carrier, because it's a simplified type of piece that comes into play. You'll notice that when we go into the software system for Medicare.gov, boy, that's a different look, isn't it? Well, it's a change that came about within the last week or so that's supposed to simplify the uh, use of this software system. It's what it is, website for the government, and how people can access information. And for us in this circumstance, how do we find out where the 5-star plans are? Well, there are periodicals that will pop up and speak to what plans are available, and we'll make certain that this is an older piece, and so that doesn't really apply here. Pardon me, I was looking for some reference material, but this gives us then a way of finding the different star plans and what they're available. But for us, when we look at a plan comparison, and many people still use the plan finder on Medicare.gov outside of some of the other software systems that are there, we want to make certain that, hey, if I'm dealing in this zip code, am I going to be able to find a plan that is a 5-star program? So let's go in and do a little bit of examination here and look at, well, here's my home zip. What's available there? How do we find these different programs? And I'm going to eliminate the use of some of the programs with extra benefits that or extra support programs that are out there, simply because you'll find that many of those aren't 5-star rated. Look at this. I'm going to skip the drugs for now. It's going to tell us some different things that are available there. But we then can go into the different filters and find the differentiating factors for these programs. And let's do that with a very simple apply a 5-star rating parameter to this, and it'll tell us in this zip code what's available. And we'll see that in this market, there is one company offering 5-star programs, and in this circumstance, it's United Healthcare. But let's look at a different area to see just how that affects. Pardon me, we're thinking here kind of hard here. Let's look at. I'm thinking of a zip code that may give us a different opportunity here. Let's go into Florida. And see what's there when it comes to a 5-star program. And we'll see then as we shift areas that this market has a 5-star offering, a singular one, 3 different programs, but it is Cigna that is offering the program. So it gives us the information we need as to what's available when it comes to a 5-star program and how we can find these plans and what they're available in our particular market. It gives us not only the opportunity to do a dissemination of information to our prospects and clients, but this gives us then the opportunity to go into a marketing strategy. Are we contracted with this particular carrier? Are they supporting our efforts to pursue this business? And you'll find, obviously, that the carriers at this point in time want your help. They want you to sell their programs, and they may have additional support available to you to help you in those efforts. So how do you bring that about? Well, you got to have a relationship with the agent managers in that market for that particular carrier. You got to be contracted and certified. And in many cases, you got to exhibit a little bit of production outside of just using a 5-star plan. You can illustrate that with, business from other carriers when you speak to the agent managers and let them know that you're proficient in explaining the programs, and you want their help in doing so with their particular plans. And you'll find in many circumstances that they have specific marketing material to help you in that effort. So that makes a big difference for us when it comes to marketing the programs. And keep in mind that if we get into these plans and we get into a discussion with a prospecting client about these programs, however that discussion comes about, as long as we're doing it compliantly and have the scope and everything else, you may find that as we start discussing the 5-star programs, well, hey, that's a great plan, but none of my docs are in it. What have you got for me that might be better for me outside of a 5-star program that delivers the care through the folks I'm seeking care through now? And because we went through some of the other special election periods very quickly, you may find they may well qualify for a different special election period that will enable them to update their coverage throughout the year. And it gives you then that opportunity to speak to a broader spectrum of available programs. And you're utilizing a 5-star opener, even though that may not be their best choice based on their own particular situation. You look at this plan, however, in Florida, boy, that's a strong program. You got a ton of ancillary benefits. You got a very nice low maximum out of pocket, low MOOP on it. But if the docs aren't there, or the formulary is a little different than what they need, you might find that, hey, I want to look for something different as well. So you can utilize Medicare.gov to not only nail down the information that's needed to speak to your prospects and clients, but also help you create or morph your marketing programs moving forward based on what's available in the area, how you can utilize support from a particular carrier. Obviously, you want to render unto Caesar what's Caesar's. They're helping you get in front of people, they're helping you sell, but we want to deliver on the best plan for that individual. And that may well be something that's not a 5-star program. So we want to make certain that we go through and we look at these 5-star steps and what is available and how this makes a difference. For us, you see a lot of push with the different carriers that speak to this simply because a 5-star program, well, the higher your star rating, the more the carrier gets paid for that individual on a per member per month basis. And that gives the carrier then the opportunity to influence their entire portfolio because they have funds available, but it helps them maintain the coverages that are there in the face of reality where medical costs are going up year over year, and sometimes the funding for these programs don't match that increase in the medical cost. So having a higher star rating helps them maintain the benefits of that plan and perhaps with some other things in the rest of their portfolio. So it can make a difference in how you visit these individuals and what it can make a difference. So we want to make certain that, okay, this is dated because the end stage renal is no longer there, but it gives us then the opportunity to realize that many of the things that we do in our marketing practices can make a difference. So you see these plans across the area. We demonstrated where they may be, pulling a bunch of information from an old UHC plan that gives us the detail on how some of these carriers explain these benefits to us. And we want to make certain that we can deliver upon a good choice. But it's important for us as well to figure out how we can find these individuals. This is an illustration of one of the carrier partners and one of the things that they do to help us find these folks throughout the year. And that includes going into circumstances where, as I mentioned before, we work with providers, we work with pharmacies, we work with other centers of influence in the community to find people that may have a bit of dissatisfaction with their current program, and other ways of getting in front of the folks to deliver upon that message. And the carriers, as I mentioned, will have marketing material to help you in that effort. So here's some things that United does in their toolkit, the marketing pieces that are there, the results that come about because of it, and it gives them then the opportunity to add additional extras. So those benefits are many times predicated by the fact they're getting paid more on it. And we're then able to utilize some of our other marketing material or efforts to reach people and highlight it with a 5-star program. So pardon me for a moment as I bounce back to the other presentation piece that gives us an idea as to how we can help you in that regard here at Premier. We have an opportunity to make certain that we can ease you into a contracting process. For many of the folks in the Medicare Advantage world, we will use electronic links direct from the carrier in order to expedite pieces as well. But we'll find as we get into those discussions with folks on an MA plan, they may have a need for additional benefits that are ancillary in nature, additional dental benefits, some things to help us with hospital indemnity programs because there's a copay on the MA plan for the hospital benefit. Or as we discussed yesterday, specific chronic conditions that bring about expenses that aren't necessarily medical in nature, but we have to deal with on an ongoing basis as we deal with certain health conditions. So cancer, critical illness programs, things of that nature. Creating an agent profile insurance bay gives you the opportunity to contract very quickly with additional carriers electronically, and it slides through the entire practice. It's like everything else we deal with, it seems like. Our handwriting has a factor that comes into play. We as agents are becoming much more adept at doing things electronically as well. This is all part of that process. We do offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You got to contract with us. But this is a program you own. So it's not like being added to a blanket E&O for one policy and you have to worry about how am I going to get coverage for the others. You own it. It takes care of you regardless of whom you contract through for a different product. We do also offer discounted continuing education credits through our association with WebCE to make certain that your license stays in play. And you can add to your own benefit package through a modified guarantee issue disability income program that you're paid a commission on for yourself, enlarging your own benefit package. We do, as I mentioned before, record the majority of our presentations, and they are available on our website and on our YouTube channel. So you can go in there and look at the entire library of programs that are available, including today's presentation. Our availability to making available Medicare Center to our contracted agents is a big thing. It really is. It's free. I have a hard time saying that as an old MA guy, but it's a way for you to do things electronically and maintain control over your prospects and clients, and do so in a fashion that enables you to stay above board and reference 5-star programs as necessary. We also have a place on our website to make certain that you realize that certain programs do carry additional incentives. This is where you can go to find out about them, and our lead programs that come as part of these programs as well. So bear with me just a moment. I have to take a short. I apologize for that delay. In my neck of the woods, we're dealing with a lot of pollen and other allergies. I'm susceptible to upper respiratory, and I don't want to have you be involved in my coughing fits. I apologize for that. Some of the things that we can do, however, at Premier to get you in front of folks, we have contact lists that are made available to you. custom made by your parameters that you're looking for, available at low or no cost, depending upon your contracting situation. Butted up against do not call. Obviously, you can't call for MA programs, so that eliminates that means of reaching out to the public for MA 5-star plans, but there are other ways that you can use that to market. We do also have different programs that can help you with the marketing through different community-based programs, and that includes the delivery of presentations, either live or virtually on 5-star programs, talking about the availability of these programs. Some of the carriers that you work with throughout the year may also give you generate programs for you, and that then can make a difference with your choice as to what carriers you want to work with. But that's kind of a quid pro quo situation where they work with you because you work with them. We do have internet leads available as well, direct mail support, a really cool T65 Locator program, and a neat way of reminding you how to work referrals into a system so a singular lead is multiplied. That direct mail program is a discount program based on production. 2 different avenues to follow through, one for health and one for final expense, so you can qualify twice in a month. We do so through preferred lead vendors. We do that to make certain that we can vet the letters that are going out and that the systems that are delivered by these companies help you in your marketing efforts as much as possible. We do also have direct mail responses that are untouched, fresh, made available through one of our partners. They vary in cost and availability by the time of the year, the market, that sort of thing. It's a real supply and demand thing, but it's a great way to fill your calendar as well. We do have, with those Facebook leads or internet leads, they are based on Facebook for both final expense and Medicare, another way of plugging into a calendar and making it work. There's the whole I can do that myself thing, or I can buy the system. This is a way of utilizing Facebook leads without doing some of those efforts yourself. That T65 Locator is a smart program downloaded to your smartphone. You register on it. It verifies that you have contracts with us, and it gives you the opportunity to find where people live on different parameters that you set with the system and utilize that. Some folks will door knock on that for MedSup or final expense or dental. Obviously, you can't door knock for MA or PDP programs, but a great way to market in a different fashion. We do these things because we want your business. We want the opportunity to be your partner and grow together. And these systems of utilizing 5-star plans as a marketing piece and a way of delivering quality care to your prospects and clients is something you can add very easily. If you're already contracted with carriers that offer these programs, you don't have to do anything extra. You just need to pinpoint where the plans are, how it works into your marketing program, and go forward. If you are not contracted with a carrier that may be offering a 5-star program in your area, we need to get you contracted and certified and ready to go with it. Keep in mind, next month, AHIP is going to be available for 2023 programs as well, but this is something that you don't need to wait. It's there for you and ready to go. So all that said and done, I'm going to take a quick peek to see if I covered questions we needed to, and it appears that I have. You can reach us for further detail on this at 1-800-365-8208 or through our website at premiersmi.com. If you have contact information for your marketer that you're working with Premier, obviously you can reach them directly as well. This is, however, something that gives you the opportunity to move forward immediately, depending upon your circumstance. And for those of you that have done business with us here at Premier, I thank you for that business. For those of you considering doing business with us in the near future, I thank you for that opportunity. But most importantly, I thank you for your time with us here today, the investment of that. Hopefully, you'll have picked up a pointer or two out of today's presentation that can make a difference for you in your market. And we will have this information available to you as well. So all that said and done, Until we're able to speak with you again in the near future, I wish you good selling. Thanks so very much. We'll talk to you soon.